Hey, health junkies! It's time for The Health Fix. Join your host, Dr. Janine Krause, as she gives you a dose of what you need to know and do right now to take control of your health from the inside out, to rebel against aging, look damn good, fight stress, and laugh every day.
Hello there, health junkies. Welcome to another episode of The Health Fix. I'm your host, Dr. Janine Krause, and today I'm interviewing Dr. Diana Driscoll, all about invisible illnesses and her struggle with one. In my practice, I see a lot of patients that have invisible illnesses. These are conditions that you can't necessarily tell the person's sick, but they've got a lot of symptoms that they're struggling with. And unfortunately, a lot of people assume, even doctors, that these folks have something that's going on in their head and it's not really happening, which is sad. So this podcast is dedicated to anyone out there that's struggling to find answers with their condition. Dr. Diana Driscoll and I hope to inspire and give a little strength to those out there struggling and asking questions as to what the heck is going on with their body. So, like me, Dr. Driscoll's a geek, and we like to geek out on things that are a little nerdy. So we're going to nerd out a little bit with you today on these invisible illnesses, and we're going to talk all about a product, actually two products that Dr. Driscoll has discovered. So, Dr. Driscoll is an optometrist who recovered from her disability after a decade. Even her children became ill, and her son was even unable to attend school for almost 3 years. So she's going to talk all about that in today's podcast and her struggle to figure out how to get herself back to health. Her journey not only offers help and hope for others dealing with invisible illnesses, but has culminated in unique ways to maximize health, longevity, and quality of life for herself and others. She is such a wealth of information. What am I doing talking? Let's get on with the podcast. Hey, health junkies. Welcome to another episode of The Health Fix. I'm your host, Dr. Janine Krause. I have a lovely guest on the line here today, Dr. Diana Driscoll. We are going to be talking all about the vagus nerve. We're going to be talking all about postural orthostatic tachycardia syndrome. Probably something you've never heard about before, but need to know because you might know somebody that has this. And we're going to talk a little bit about her story of how she came to create some of the products she has, as I love Parasym Plus, and we'll talk about that in a little bit here too. So, Dr. Driscoll, say hello.
Hello, everyone. Thanks for having me, Dr. Krause. It's really an honor to be here, and I love how you share so much great information with folks out there who need it.
Absolutely. That's the name of the game here, helping folks to advocate for their health. And in your case, I think we have a great story to talk about in that, most of your life you were healthy. You went to Costa Rica, came back with a virus, and life started to unravel. And I think your story is so fascinating that I can't wait to hear about it. So please do tell us what happened. How did things fall apart and what got you to where you are today?
Right. And before we throw Costa Rica under the bus, I'll tell you, It's a beautiful place, right? It was really an amazing trip. And all of us got a virus on that trip. It wasn't just me, but I seemed to be the only one who didn't recover. I just couldn't pull out of it. And a couple weeks or so after returning, I started to show some really strange symptoms, and I had trouble breathing. I noticed my heart rate was going all over the place. My digestion started to be affected. I just couldn't get an answer. The doctors were really mystified by it. So that just started, that unraveling, that's a perfect word for it. The symptoms just continued. It's like dominoes were falling. I couldn't control my blood pressure or heart rate. Even it was positional. It depended what position I was in. I couldn't control my own temperature. Even 1 degree change, I just couldn't handle it. And eventually it started to morph into more of extreme fatigue. And it wasn't just fatigue. I almost don't even like that word. There were sometimes I just felt like I couldn't even move. And yet, as fatigued as I was, I oftentimes couldn't sleep. I had insomnia. I just got weaker and weaker, and then my brain function started to go. It got pretty ugly. So, and yet nobody had any answers. I eventually did get the diagnosis of POTS, which is postural orthostatic tachycardia syndrome, which means basically the criteria that if you are horizontal, you rest for a few minutes, and then you get vertical, your heart rate should go up a fair amount, usually 30 beats a minute on an official tilt table test. And mine certainly did. But no one had any idea of why that was happening. And instead, they just tried to treat the symptoms, even though we went everywhere for answers, everywhere. No one had any idea of why this happened. And then our kids became sick. My son became very sick. He was 8 years old and started to develop similar symptoms. He started fainting. Then he just started wasting away. He developed extreme osteoporosis. He broke his arm just throwing a ball and broke his other arm putting his jacket on, but no one had any answers. So extremely frustrating, tons of symptoms. And we're left with a diagnosis with just symptomatic treatment that wasn't working. So we were up a creek, and I was on a mission to get some answers. So when the doctors finally told me, these are the researchers, I was participating in clinical trials for this for 3.5 years, and the researchers told me, well, our conclusion is that patients with this are actually perfectly normal. They're just more aware of their own bodies. We're on our own here. So I turned to my husband and said, we've got to figure this out. We set up a corporation, started to do studies, and started to look into it. But it was not an easy road.
Oh, my goodness. Yeah, I can, I tend to see as a naturopath, a lot of folks are coming in with what are known as invisible illnesses or illnesses that are in your head, because I would say that definitely you're more sensitive. So it's in your head kind of concept is very, very common.
Yes.
It's just, it's so sad. And in this case, you said 3.5 years of figuring out what to do.
Well, I was on disability for over a decade. It took longer than that to get. That's when we realized we had to actually start looking for the answers ourselves. I thought initially, first I thought I'm just not getting to the right doctor. My presentation is so dramatic. They're missing something. So I just went from doctor to doctor. And it wasn't until we ultimately ended up at Mayo, and that's where, after the clinical trials, they said, well, we just think you're normal, that I realized, okay, well, that's not true. And I was 46 years old when I got sick. So it wasn't like they could tell me, oh, you're just more aware of your own body, or it's hormones, or it's you're a teenager, you're going through something. No, it was so obvious it was medical. I thought they're just not digging deeply enough. But you're right, that invisible illness spectrum, I think I like to call it, it almost depends what doctor we end up with, who we end up seeing, who diagnoses us, what label we get. I see POTS is not uncommon, but chronic fatigue syndrome, even fibromyalgia, etc., that kind of lump of we're just miserable and nobody knows why.
Right.
There's a fair number of overlapping commonalities with us, and we've got to start picking that apart.
Absolutely. Absolutely. And how you mentioned, chronic fatigue, all of these different things, I often tend to go to, okay, well, why does someone end up with this? How does a virus send us into this catapulting of fatigue, or unraveling really of the body? And in your research, because I know you have a research with your own patients, I've seen on your website that you're using a lot of your own patients for your research. Have you found that there is a connection more often than not to viruses and invisible illnesses?
We see a fair number of people who seem to be triggered by viruses, like my son was, but he got a series of 3 regular viruses. I say regular, the ones that went around the school, all of his friends got them. They weren't unusual viruses, they were regular, but he didn't seem to pull out of it like I didn't pull out of that one I had. But our daughter also developed POTS, and she had no trigger that we're aware of at all.
Oh, wow.
Here at Potts Care, we see all kinds of triggers, everything from stress to certain bacterial infections, sometimes viruses, trauma, either physical or mental. Every once in a while, a vaccination will do it. But everybody's a little bit different. What brings them to the illness, it appears that the trigger itself is not necessarily the blame, if you will, but why did we not respond or heal the way other people do? Is it us? Is something getting hung up in our bodies? And that's really where we go to start looking at it. It's extraordinarily complex, and everybody's so different. So it's a tough puzzle to help figure out, but we have to dig deep to get those answers, and we do. So.
Absolutely. I might know a little about that digging deep in the realm. And speaking of, when these illnesses are linked to why does someone respond better in one respect versus the other, I do look at the vagus nerve quite often, since it is our sensory of our internal, check-in as to what's going on, and also our ability to control inflammation. Tell us a little bit about what you learned about the vagus nerve through this whole process, because I think that the vagus nerve seems to be one of the commonalities for a lot of the symptoms that folks, especially with POTS, but also even chronic fatigue and going into even fibromyalgia, experience symptoms of the nerve being dysregulated.
Absolutely. And you brought out such a good point, because for years, no one really knew that was the anti-inflammatory nerve of the body. And we didn't figure that out. Dr. Kevin Tracy of the Feinstein Institute of Medicine figured that out. And that was a big piece of the puzzle. I initially started suspecting it. It was long before anyone ever spoke about the vagus nerve. That wasn't really something on the horizon. But when my heart rate and gut problems both started at about the same time. And anytime you have symptoms that are fairly disparate, you try to think, what would tie those together? And that would be one thing that could tie those together. And then having POTS, I had a specific form of POTS called hyperadrenergic POTS. And this is just a miserable condition where I was flooded with norepinephrine. I was in that fight or flight mode, that sympathetic overdrive mode, living constantly as if something just scared me, that kind of adrenaline rush, horrible imbalance there. And knowing that the vagus nerve is the calming nerve made me wonder, did something happen there? All of my doctors tried to treat it by lowering the sympathetic nervous system, that fight or flight, which made sense. I was flooded with adrenaline, and Xanax probably allowed me to survive, those initial couple of years. But no one ever thought, could the parasympathetic nervous system, that resting, digesting system, be underperforming? And if we help that along, could that autonomic balance be achieved again? And it took both. But the vagus nerve, oh gosh, it's such a long story. I think it's a good one, though, because the details are important, and that's really how I figured it out. It basically got to the point where my gut completely shut down. One, the gallbladder wasn't working, which was an interesting clue. They wanted me to remove it. They tested it, and the ejection fraction was just pitiful. It was 8%, which is basically nothing. It's just sitting there not doing anything. And they said, well, we should remove that. And I thought, well, is it like an appendix? Is it infected or something that's going to explode? Or no, it's fine. It's okay. Is it filled with stones? That could be a reason to have to remove it. And said, no, there's no stones. And I thought, well, gosh, is the opening maybe stuck closed? You can see that on imaging. They said, no, it's open. And I said, well, it sounds like, one, it's not urgent that I remove it. And then two, it sounds like it's just sitting there waiting to get a signal, like, let me know when you need me. I'm here to kick out some bile. And it's just not getting that signal. And I said, I'd like to think about this, because if it's a neurological thing and we can get that organ working again, I'd like to keep it if I could. And fortunately, that was part of the issue. But really what forced my hand was I developed gastroparesis, where I couldn't have a bowel movement. Just nothing was moving. And I had tried everything. And you know how you do when you're going through an invisible illness. You have to try everything yourself first. And nothing was working. I ended up at my doctor's office. Excuse me. And she had no idea what to add to it. But she said, gosh, could some of the discomfort you're having, I had some vague pain, lower right-hand quadrant, be maybe a kidney stone? Of course, it didn't sound like a kidney stone, but I just think she was giving up, which I understand. She sent me to a urologist, and he had me drink this dye that they image for stones, and everything looked fine. But he was one of these super smart and nice doctors, so I discussed with him what I was suspecting about a vagus nerve problem. And I was looking at maybe compression at the neck at the time. I said, if this is part of the issue, could it just be shutting things down and it's keeping the ileocecal valve from opening? And that's the valve between the large and small intestine. And it happens to be in the lower right-hand quadrant. I thought, could that be causing that discomfort? He thought that was pretty cool. And sent me to a surgeon up the hall to take a look at that possibility. The surgeon was also great. He said, Diana, if you're suspecting a vagus nerve problem, don't have abdominal surgery unless it's life-threatening, because we just cut right through those nerves. We cause gastroparesis. I was horrified.
Yeah.
I appreciate his honesty, though. So I left there, still no answer, still no bowel movement. I was looking at about almost 2 weeks at that point without a bowel movement. And it's one thing not having a bowel movement. We can handle that. But it was that on top of just being so sick. And it was just too much. But something interesting happened at about this time. And it just had to be a God thing, because I couldn't have planned this better. I got a kidney stone. And it was about 3 days since I saw the urologist. And I called him up and I said, I realize I didn't have a stone 3 days ago. I understand that. I respect that. I do now. And I had never had a kidney stone before, but I'd heard what it feels like. You kind of know immediately. And
right.
He met me at the hospital and removed my kidney stone. It was a stone. And when I woke up from that, he was just so close to me and he said, Diana, you're right. And I said, what? And he said, it's your ileocecal valve. And I said, well, how did you know that? He said, well, we use fluoroscopy to guide the stone removal. And that dye I gave you 3 days ago is still in your GI tract, but it's all crammed up against that valve. He said, that valve's not opening. I said, okay, we've got something definite. We know that's not working. What do we do? He said, I have no idea. He sent me home. So I'm at home, no help. I had gone to the emergency room. They gave me a prokinetic. That did nothing. I didn't know where else I could go, Janine. I was just stuck. So I thought, well, okay, let's just assume I'm right. Let's say it is a vagus nerve problem. If so, is there a way I could work around that? Let's say it's destroyed for any reason. And I remembered my anatomy in school. Unfortunately, I'm just a super nerd. This is one time it really worked in my favor. And I remembered in class hearing the professor say, we were studying the vagus nerve, and there's two parts to the nerve. There's the long preganglionic portion. It goes from the brain down the neck, into the chest cavity, down to the abdomen. It's the longest cranial nerve in the body. And then there's a gap, and there's a tiny postganglionic vagus nerve, tiny. And I remember him saying, word for word, saying the postganglionic vagus nerve is so small, it's almost a part of the organ itself. I have no idea why I remember these details, but I thought, okay, well, as far as I know, I still have that postganglionic vagus nerve. Could I maybe stimulate that nerve? Could I figure out a way to work around that defunct preganglionic vagus nerve? And I thought, well, let's try to introduce the neurotransmitter. Nerves, of course, communicate with a neurotransmitter chemical. And the neurotransmitter for the vagus nerve is acetylcholine. But okay, acetylcholine, thinking it through, that's not a drug because the body breaks it down immediately. Cannot use acetylcholine. But okay, you have to use an imitator, or what we call an agonist. But what is the agonist for acetylcholine at the site of the vagus nerve? And I thought, oh, well, that's easy. That's like the only one I remember because the vagus nerve is the only nicotinic acetylcholinergic nerve in the body. And the reason we call it that is because its agonist is nicotine. So I called my husband at the office and I said, honey, on the way home, can you swing by the drugstore and get me a nicotine patch? He's like, a nicotine patch? What are you up to? Like, I'll explain later. He was kind of getting used to me doing little science experiments on my own body. But he brought that patch home, and I didn't know if it mattered, Janine, where I put it, but I thought, let's put it over the side of the ileocecal valve. And I kind of pictured the nicotine going through the skin. It's transdermal, right? And it going through the tissue and landing on the receptor of the postganglionic vagus nerve. And if I handled it right, maybe it would trigger things to start moving. And hour and a half later, things started moving. The valve opened. I had a normal bowel movement. I was like, what? So the next day I used it again. Normal bowel movement. I did that for 4 days, and then I had to stop using it because nicotine, as great as it was to pull me out of that, has an ugly side. It also activates inflammation, and it had activated some of these very cells that were a problem for me. My stomach was purple. It was itching. It looked like it had been attacked by fire ants. And I've ruined everything. But it taught me some lessons, and I thought, one, all the research to date on POTS was thinking we had some autoimmune conditions affecting those receptors. But this was effectively a test of the receptor. It worked fine. The receptor was fine. We steered all the research away from autoimmunity. This was either a problem with that preganglionic vagus nerve, it was damaged, not working, whatever, or it was a problem with the neurotransmitter, acetylcholine. Either we weren't producing enough, it was getting broken down, or whatever. There was a problem with the neurotransmitter that I had to go to next steps to figure out that layer. Quite the journey.
So did you do some neurotransmitter testing on your own, so your analysis style or any of that?
No, there really isn't good testing for acetylcholine, again, because the body breaks it down. In fact, if someone is poisoned with an anticholinergic drug that breaks down acetylcholine, doctors are trained to recognize that based on presentation because there isn't a test for it. So, and it happens to be something I'm familiar with as an eye doctor because we study anticholinergic medications exhaustively because we use them every day. They're the drops that dilate the pupil, for example. So you go to the eye doctor, you get an eye drop, pupils are dilated. Everybody hates to have their pupils dilated. But we know if, say, we prescribe that and little Sister Susie or whatever grabs that bottle and sucks on it, she could develop anticholinergic poisoning, so we know to recognize that. Wow. So what I did instead was I sent out checklists to POTS patients, chronic fatigue, fibromyalgia, and interestingly, PTSD. They also show autonomic dysfunction. And I put in a bunch of symptoms of anticholinergic poisoning. And over almost 5 years collected those and found, no, it's across the board. The majority of patients show the majority of symptoms of anticholinergic poisoning. And it wasn't like we had been poisoned, but I knew this was likely not a vagus nerve problem per se. The vagus nerve problem was secondary. This was a problem of the neurotransmitter. And that's one reason some of the other symptoms were occurring, like dry eyes or large pupils, brain fog. Even I got to the point of dementia, honestly. That was not a vagus nerve problem. Those were symptoms of acetylcholine problems. And then went into how could we maybe boost acetylcholine to a degree where it stimulated the postganglionic vagus nerve like nicotine did, without the inflammation that nicotine causes, without the oxidation and other problems, and also cross the blood-brain barrier to boost it for the brain, to stimulate the lacrimal nerve, which controls tear production, to help with the dry eyes, to normalize the pupils, calm the body overall. And that was quite the effort. It took a few years to put that together. But I thought, if we get this right, this could allow maybe my son to start absorbing nutrients again, because the organs start to work again. Because the vagus nerve controls all aspects of digestion, including gallbladder function, pancreas to some degree, stomach acid reduction, motility, the whole bit. And when that's not all working well, you can't break down your food properly, and so you can't pull out the nutrients. And that's exactly what was happening to him. That's how the osteoporosis got so bad. It got so bad for me, Janine, I was even hallucinating sometimes. But no doctors would recognize this was severe nutrient problems. I was eating just fine. My son was eating just fine. In fact, nutrition had always been kind of a hobby. I enjoyed eating well, but I wasn't getting the nutrients out of that. So we had to normalize that. So trying to figure out an oral supplement to do all that, no one had ever thought to even attempt that. It's not intuitive that you could do that,
Right.
But it took about 3 years to put all that together, and ta-da, then yay, we came up with something, and now received just recently a second patent for it, because it's truly a new discovery that you could do this orally. So we're pretty excited about that. We call it Parasym Plus, as I think you had mentioned, and game changer for most of us.
I can't wait to talk about Parasym Plus in a second. I have a couple of questions, because I think there's some folks out there that are going to be like, well, what if I don't have a gallbladder? Does that set me up for having issues with signaling and neurotransmitters within the vagus nerve? What's your opinion?
That the gallbladder is signaled by the vagus nerve, but not vice versa.
Okay.
So we see plenty of patients here at PodScare who have not been able to save their gallbladders. And I really did get lucky, and I know I'm lucky that I was able to figure that out and save it. And I understand the people who just weren't there and had to have theirs removed. But you can live without a gallbladder. Life is easier. I like cheese on everything. What can I say? So it is a little bit easier. You can live without a gallbladder. I think if some of the people we see without a gallbladder, if they eat certain foods, high fats or whatever, then some digestive enzymes might be a nice thing to have. Having said that, we see a lot of people who are very sensitive, as you had mentioned, and people who have poorly functioning vagus nerves for any reason tend to be very sensitive because of the inflammation that's poorly controlled. So you have to be careful what digestive enzymes you give, like protease, which helps break down protein, which is necessary and great. It can really hurt that stomach lining. So very low levels of protease. We want to be kind of picky on digestive enzymes. But all is not lost if you don't have a gallbladder. Okay. But stomach acid production, we want to normalize that. We want to normalize motility. A lot of us end up with SIBO, SIFO. I had all of that. Horrible dysbiosis because I didn't have motility. Things were not getting broken down right. And things were just in there. It sounds so nasty now, doesn't it? Just kind of fermenting and creating some really nasty stuff. It got rough. That all just basically normalized. Getting all that normal production of digestive enzymes from your gallbladder, bile and stomach acid, and then the motility. I cannot emphasize the motility. If you're not moving the bowels properly, they sit in there for too long. That's not good. So all that was important.
Makes sense. So one of the other things that I wanted to ask before we jump a little further too is a lot of folks will have dry eyes and have been diagnosed with Sjogren's.
Yes.
Do you yes, there's the genetic testing to 100% confirm it. And a lot of times I'll ask folks, have you had the genetic testing to confirm you have Sjogren's? And they're like, no, my doctor just told me because I have dry eyes, I have Sjogren's. And I'm like,
yes.
Is that 100% accurate, or do we have something going on with neurotransmitters?
I am so glad you asked. Being an eye doctor, this is a real interest of mine because like what you said, we see it all the time. People will say, I was diagnosed Sjogren's because I present that way. Very dry eyes, usually dry mouth. And if the blood tests don't confirm it, it leaves open the possibility that this is something that's mimicking Sjogren's. So important. So if this is a problem with acetylcholine, much like mine, absolutely dry eyes, dry mouth is secondary to it. And in our clinical trials on Parasympathetic Plus, honestly, the first trial, it wasn't until the end, 4 to 6 weeks into it, we were so focused on the gut, we didn't even look at the eyes until the end and realized, oh, look, the dry eyes went away. And we kind of had to back up and look at that again. So with Sjogren's, either true Sjogren's or an imitator of Sjogren's, you want to boost acetylcholine. If someone has true Sjogren's, inflammation actually destroys the lacrimal gland, the gland that produces tears. If the gland is destroyed, you're not going to be able to make tears. Okay, we get that. But early in Sjogren's, inflammation blocks the release of acetylcholine at the lacrimal nerve. So if we can go in the back door, we can stimulate that postganglionic lacrimal nerve or the receptor itself, and we can kick out some tears. As long as there's a functioning gland, you have a fighting chance. For people who do not have confirmation or the doctors cannot confirm it, you have to consider the possibility that it's an acetylcholine problem. And I see it all the time. It's almost always missed. I think one reason is we don't have a good blood test for it. We have to look at presentation. And being an eye doctor, I will tell you, before I ever got sick, before I went through this whole journey, I would have never considered, is this an autonomic nervous system problem or a problem with the neurotransmitter? We didn't go there. We just didn't go there. We label it and we treat with the prescriptions and drops and everything else we have. But I was one who developed severe dry eyes, and I was on everything, and I couldn't get rid of it until we figured out that piece with Parasympathetic. So, thank goodness.
Absolutely. Thanks for sharing on that, because I do think that that's a big issue with a lot of people. So
I agree.
Let's talk about Parasym Plus a little bit and the ingredients that are in it and kind of how they all work together synergistically.
Yeah, this was tricky again because I had a lot of goals, and you should be able to make your own acetylcholine, right? You shouldn't need to supplement things to come up with it. Instead, I was trying to figure out, first I thought, this is likely a genetic problem with acetylcholine. And my thinking at that point was, we're set up for this somehow. What are the chances I can develop POTS, my children can develop POTS, and yet there's no genetic influence? I thought there's got to be some genes. So at first I looked at genes involving acetylcholine production and studied those for a while. And we did find patients with those genes, but it wasn't that common. It certainly wasn't the majority of people. So now those people, it is life-changing to boost acetylcholine and work around them. But what I did when I was working on Parasym Plus, I thought, okay, people aren't going to necessarily know their genes. I didn't know mine for a while. Can we work around these genes and put that workaround right into Parasym Plus? Yes, we can, and we did. Then I considered, what things could we get deficient in? Because so many of us were so prone to deficiencies that if we had a nutrient problem, if we didn't have enough nutrient, that we can't make enough acetylcholine, we put that in. And then I looked at, okay, what can we do to boost the production of acetylcholine so if all the ingredients came together correctly at the same time, that it could stimulate that postganglionic vagus nerve, and we could look for a bowel movement. So it took everything. It really did. And the amounts of the ingredients were important. Some of them, like the cholinesterase inhibitor, which breaks down an enzyme which destroys the acetylcholine. You don't want too much of that. Then the receptors start to shut down, and that ends up working against you. So it wasn't just a matter of just dumping ingredients together. It took quite a finagling to try to figure out how much of each one, et cetera, to get the perfect response. And again, we were focused on a bowel movement. We found that in our last study, what we did was we mixed it with food, because we thought, how great would it be if we have to have this every day, that we put it in a breakfast bar or a smoothie or something, get it on the way out the door. It didn't work. It didn't work. So it did have to all go in basically at the same time to stimulate that nerve, and that was really important to me. It has to cross the blood-brain barrier too, so we had to be careful with that. We had to figure out something that would allow us to get everything we need into the brain. That can be tricky. Blood-brain barrier is a little bit tricky, so it was quite the project. But I'm just a real chemistry nerd. I always loved organic. I mean, that's very strange. So that was kind of fun for me to kind of work that through, but it was godsend getting those answers.
I bet. Now, I know, of course, you have a proprietary blend, so we're not going to send out the secret sauce to everyone. But I think for kind of helping folks to understand, the blood-brain barrier, when it's leaky, it's hard to get things, in and stay in. Now, the particular part of the formula for the blood-brain barrier, so folks can kind of understand what's exactly doing what, could you shed some light in terms of what does what in the formula?
That's probably a little bit more information that we can really explain easily, but I will tell you it's almost the opposite, Janine, interestingly. When the vessels are affected and the blood-brain barrier gets leaky, things can cross into the brain that are not supposed to go in.
Sure.
It's actually easier to get things into the brain if that blood-brain barrier is affected. It's when it's healthy that is the issue. It's the gatekeeper. It's supposed to keep out certain molecules, etc. So, for example, can I give you for instance, if we need to boost choline, and this was some of the genetic issues, one of them involved choline. Some people need more choline than others, and choline is a real problem because it's difficult to get it to cross the blood-brain barrier, and the sheer volume of it is unrealistic. So we had to find another form of choline that would cross the blood-brain barrier easier, and we didn't get the side effects from adding the massive quantities of regular choline. Some people can't eat enough choline to get what they need. So that was one we had to spend a fair amount of time on.
And you're referring to the alpha GPC.
Yep.
Yes. Okay.
So
those of you who are listening to this and wondering what I just said, if I just sneezed or something, I'm talking about a type of choline that is absorbed into the body more readily. And it's one of the ingredients in the Parasym Plus. Now, let's talk a little bit about some of the newest research that you have, because you've got another product that kind of goes along the same lines, because when I'm finding that folks have issues with their vagus nerve, I'm also finding, and neurotransmitters and all of that, I'm also finding that we have some issues in terms of signaling. We have issues in terms of processing, sometimes in the liver, sometimes histamine responses. In your case, you were doing some research on N-acetylcysteine. Yes. And you have something called NAC Max. So tell us a little bit about how that might be synergistic or might also help someone with an invisible disease.
Absolutely. This is a game changer, Janine. And this isn't just my research. We started with looking at existing research. What have people already figured out, which really helps. And if you spend time with chronic illness people, or use air quotes there, you'll see a lot of anxiety, kind of OCD presentations. It can be crippling sometimes. People are more prone to panic. They can end up, the worse they get, they can end up afraid to leave their homes or afraid of anything, driving, talking, just horrible. I got so bad that I couldn't even answer the phone, or if someone is at the door, it was just too stressful, to try to answer the door with somebody I didn't know was there. It's just a horrible place to be, to live in that kind of free-floating anxiety. You can't even tell where to put it. What that turned out to be was a chronic inflammation is kind of nasty, and it does a lot of bad things. One thing it does is it increases oxidation, and oxidation is damaging. It damages blood vessels, it damages tissue, and it starts to change brain chemistry. And what it does is glutamate starts to increase. Low levels of glutamate, fine, it keeps us awake and perky, but when you start getting into high levels, it's a neurotoxin, and anxiety starts to go up. And then the OCD type stuff, any form of addiction, that sort of thing. So in order to help with that, you need powerful antioxidants. We want to increase our body's level of glutathione, the master antioxidant. But you really can't do that well with glutathione. We don't absorb it well orally. When I was sick, I tried oral, through the skin, suppositories. Oh, yes. Inhaled. Oh, I tried every way there was. Nothing. No response. But the body's limiting factor to making its own glutathione is N-acetylcysteine. It's an amino acid. So with NACMAX, what we did was we took N-acetylcysteine and added selenium, because glutathione is a selenium-based molecule. If you're trying to make glutathione and you're deficient in selenium, you won't make it. And then we added a couple ingredients that then recycle the glutathione that you make. So when you make glutathione and it's broken down as you use it, it'll put it right back together, and the levels go up even higher. And then immediately, a few hours, anxiety can start to ease off. You continue with it, some of the damage the oxidation does is it starts to reverse. People start to feel better and better, a real game changer.
I like N-acetylcysteine for many things. And yes, glutamate. I was saying histamine. Like glutamate.
Close.
Brain. Speaking of brain, maybe I need some.
That's funny.
But yeah, the more that I dive into the need for helping to not only take care of the body, but also the brain, because definitely the brain is affected the more that someone is in the throes of an invisible condition.
How true. And I mean, I've been so transparent with my journey on this. I share all my symptoms with everyone. I really did get to the point of dementia, and my short-term memory got to basically zero. I was tested for my disability insurance, and I had none. I had no short-term memory. I ended up losing the ability to read. I had no what we call executive function. I couldn't organize my thoughts. I couldn't make a to-do list of even 3 things. I just couldn't do it. I was so mentally exhausted. And then I started to show psych symptoms like that, anxiety stuff. I looked like I had psychosis. I exhibited those. That was all secondary to the illness, and it was all reversible, praise God. But it was a horrible thing to go through. I felt like I was possessed, honestly. Like, who am I? Where did Diana go, and whose body am I in? It was just a nightmare, and I really feel for people going through that. It's tough.
Thank you so much for sharing that, because I think a lot of people do think they're going crazy. I think a lot of people attribute their symptoms to getting older and that they're just rapidly aging, which essentially, yes, if you're deficient in glutathione and you have, a deficiency of your natural janitor system, if you will, or your natural antioxidant system, yes, you're going to age faster. But I think it's really important that folks understand that these invisible illnesses are not all in their heads. And I know family members can be cruel. I know that, coworkers, et cetera. It can be a cruel world we live in for folks in this situation.
And, I mentioned I was older when I got sick. I knew this wasn't a psychological illness. I knew I had a history of wellness, et cetera. Thank goodness I got sick before our son got sick. Had he gotten sick first, I wouldn't have had a clue what was going on, right? But if I was a teenager or young like him or whatever, went to a doctor and they don't have a clue, they will look at the psych symptoms and tend to blame things on that. And as a young person, you're still figuring out who you are, everything. You just don't have a clue. You start to believe that, and you start to think you're just a crazy person. And, oh, how horrible is that? So, yeah, I knew this wasn't a psych condition, and I still showed psych symptoms that were horrifying. I just can't imagine being young and still trying to figure out who you are and work through all that and being faced with having to deal with those symptoms. Fortunately, they're reversible. And honestly, the younger, the better. Yeah. The younger we see patients, we can start turning things around, the better. So there is hope for everybody. Do know that as old as I was and as sick as I was and as bad as everything got before I got answers, it reversed. So there is hope for everyone.
I love that you say that. And with that being said, I want folks to know how to find you and that you are seeing patients, yes. Do you do virtual visits as well?
We are just trying to do some telemedicine. The laws are very restrictive. So right now we're just in Texas. If someone comes to Texas or is in Texas, we can do telemedicine. Most people really like to come in person. We thought, everybody would just be breaking down the door to do telemedicine. But I think you get so sick, you want some eyeballs on you too. But yeah, we see people at the clinic, and we're restricting our practice just to POTS right now.
Okay.
Because we know POTS. We know POTS. We know what can cause it. We know how to start treating it. And it's a beast of a condition. So, yeah, I'm so happy to be able to do it too after such a long journey.
Excellent. So where are you located in Texas? For those of folks who are listening who are in Texas.
Yeah. POTS Care is in the DFW area, Dallas-Fort Worth. We're very close to Dallas International Airport in Colleyville, which is basically right up the street. Okay. So we see people from all over the world, really.
Excellent. And they can find you at potscare.com.
Yes.
And we also have your other site called prettyill.com as well. And in terms of finding the vagus nerve support, so vagusnervesupport.com, but also the other is TJ Nutrition, correct, for finding Parasym Plus?
Yes, you can find Parasym Plus, NACMAX, the other products at vagusnervesupport.com. They're all there.
Excellent. Now, I always like to leave with one thing. If my folks, after listening to this podcast, could do one thing to help with their health if they're experiencing symptoms of POTS, what would you tell them? What's the number one thing they need to do right now?
You know, this is not intuitive at all. And ironically, I happen to have on POTS Care's website a free brochure, the top 4 things I would do if I was just diagnosed with POTS. And when I put that up, I know people were anticipating that to show things like I'd add high salt, I wear compression stockings. Right? No, we don't do that. We don't treat symptomatically. I would say try antihistamines. If you respond to antihistamines, there's a reason for that. But you can oftentimes just feel a little better within a couple of weeks. And if so, 1, it's a clue. 2, you'll have some more functionality. So I give antihistamines a try. You don't need a doctor's intervention to help you with that, which helps too.
Excellent. And any type of antihistamine in particular?
Yeah, Zyrtec can be really helpful for a couple of reasons, and we double dose it. Zantac can also be helpful. Right now, it's a little bit difficult to find. They're trying to look for a contaminant in that. So whenever that's available, that's kind of a new thing. I'm hoping that's short-lived.
Okay.
But H1 antagonists like Zyrtec and H2 antagonists like Zantac, that combination can be really helpful.
Okay. Thank you for letting folks know. I think that's a really good tip just to get started. It's valuable, very, very valuable. Well, I am going to put up all of our notes on drjkraussnd.com, and all of you folks listening here can tune in and find those there. So thank you so much, Dr. Diana. I appreciate it.
Thank you, Dr. Krause. I appreciate the time and the opportunity to share some of my journey because it was just so horrible. And it was 12 years of illness. There's no reason people have to be sick 12 years. But if what I've found can help others, that's really the point. It is all about the patients at this point. And there's a whole lot of suffering that, in my mind, is really unnecessary. We need to dig deeply for people. So thank you for the opportunity.
Absolutely. Digging deep. That's where we need to go. Well, I hope this podcast sheds some light on how we might need to focus on strengthening the parasympathetic nervous system versus calming the sympathetic nervous system to treat invisible illnesses. So if you know someone who needs some inspiration and hope in their struggle with an invisible illness, share this podcast with them. Also, all of my show notes are always on my website at thehealthfixpodcast.com. Just click on the link for the podcast and scroll right down to this episode. Whenever you're ready, I'm here to help you. So if you want to take your health to the next level, I always look at the gut first. So head over to my podcast notes at thehealthfixpodcast.com and grab my 4 steps to plugging your leaky gut. Or if you're interested in working directly with me, I'm now offering telemedicine visits. So head on over there and click on the Work With Me tab at thehealthfixpodcast.com and let's see what we can do for you. Alrighty. Well, that's it for today. Hope you enjoyed the podcast. Have a great day, whatever you're doing. Hey everybody, Dr. Janine Krause here. If you liked what you heard today, then head over to drjkrausend.com to find my free resources and information to know when I post something new that's juicy that you might want to check out. Plus, head over to where you get your podcasts and subscribe, and write a review to help get the word out about me and help others at the same time to find me. It really does help, and I really appreciate all of your reviews.